Well, North Carolina, as it inches closer to legalizing medical marijuana, there is another drug Mecklenburg County Representative wants to be on Raleigh's radar.
And Queen City News anchor Annie Satowski tonight shows us why psychedelics are drawing more and more attention for their therapeutic uses in people who have literally tried everything else.
It's the sound of thinking 10 steps ahead. Oxygen tanks and masks stationed all around Ken Maxwell's home near Asheville, where he can get to them at any moment.
It's like a stabbing with a hot knife in the back of the eye. Sometimes it feels like I've been shot in the face.
It's Ken's first line of defense for cluster headaches, but he's also using something else to keep them at bay, or at least make life bearable.
Psilocybin, which is the psychoactive component in magic mushrooms.
Yep, those magic mushrooms. According to researchers, when used correctly in microdoses, psilocybin can have immense healing powers without the trip.
I just take a small amount. It doesn't produce hallucinogenic effects. It's just a small therapeutic amount that helps me manage the disease.
Now, he didn't come up with this on his own. A few years ago, Ken was part of a double-blind study at Yale University, testing how psychedelics impacted cluster headaches. His results were astonishing.
And then the severity of my attacks, instead of a lot of 7, 8, and 9s on the 10-point KIP scale, I was having mostly 3s and 4s. It was the first hope I'd had in a long time.
It's why Mecklenburg County State Rep John Autry is drafting a bill right now to fund psychedelic research at universities like Duke and UNC to the tune of $4.2 million.
To look at using psilocybin, MDMA, plants, psychedelics in therapy for treating folks with PTSD, depression, eating disorders, substance abuse, terminal patients with end-of-life anxiety.
If approved, North Carolina would be among only a handful of states to pass legislation on psychedelics, ranging from legal therapeutic use in Oregon to greenlighting research for PTSD sufferers in Texas, Washington, and Connecticut. Utah, Colorado, California, Maryland, and New Jersey all working on their own framework for using the drug.
And I think the state of Texas shows that they're willing to actually do things for our veteran community besides use them as props.
Even without that legislation, North Carolina is already forging ahead. The Pearl Psychedelic Institute in Waynesville is now one of only 4 clinics in the U.S. with special permission from the FDA to perform psychedelic-assisted therapy using MDMA, the primary drug in ecstasy and Molly.
And it was used legally for therapy from about 1976 until 1985 when the DEA stepped in and emergency scheduled it, Schedule 1.
Dr. Raymond Turpin, who started the nonprofit, is already doing psychedelic-assisted therapy with ketamine, a legal anesthetic widely used in veterinary medicine.
If you give people a sub-anesthetic dose, that it can create a powerful psychedelic experience that's fairly short-acting.
In these sessions, Dr. Turpin and a medical professional go over a patient's vitals, talk about their goals, and once they take the drug, their experience can last a little more than an hour with the help of music and an eye mask.
And then when they come out, we start to do what's called integration work, which is where we try to piece together what did you experience during your time in the ketamine world, and what did you possibly take from it, and how does it apply to your intentions or your clinical issues or your growth issues that you're wanting to work on.
So what's exactly happening in our brains to help better unpack trauma?
When people are undergoing a traumatic incident, all their higher order processing goes offline. They go into fight or flight or freeze mode, and so what happens is all this fragmented, highly charged information gets stored in the brain in an improper place. It goes in and it deactivates the amygdala 95%, so that when your fight or flight or freeze reactions are turned off, it allows this fragmented trauma memories to start to come up into consciousness so that you can deal with it.
MDMA-assisted therapy goes through the same protocols, but the experience can last up to 8 hours, closely supervised at all times.
A lot of people suffering out there that conventional treatments haven't worked for, and so they're really desperate to find something else that might help them.
Ken Maxwell certainly knows the feeling.
Before I started dosing, I had a streak of 415 consecutive days of attacks, which was debilitating. It's one of the lowest parts of my life.
Now that he's nailed down a regimen that works for him, he's hopeful that the state will open up pathways for others to heal too.
You cannot tell me this compound isn't helpful. And if we're smart, it can benefit so many people with so many different conditions.
Annie Satowski, Queen City News.